Jen Binder, and I'll be your nurse this evening. Hello. So, what seems to be going on?
I have a stuffy nose, and when I blow my nose, it's kind of green and gooey.
Okay. And when did this start?
A few days ago, Tuesday.
Alright. And does anything make it worse?
When I go outside and it's cold, my nose runs.
Alright. And what's the quality of this snot? Is it a different color or?
It's green and gooey.
Okay. And is there a lot of it or just a little bit of it?
Yeah, it comes like chunks.
Okay.
You know.
And does it just stay up in your nose or does it go anywhere else? I don't mean the snot, I mean like just the pressure.
I sometimes get like headaches like right above my eyes.
Okay. And then on a scale of 1 to 10, 10 being the worst these symptoms are, what would you rate this?
Probably a 7.
Alright. And does this come and go? Is it constant?
I think it's seasonal.
Okay.
Winter.
Yeah. Alright. And then have you had any recent shots or any surgeries, injuries, anything to your nose or anything yet?
No, I have a deviated septum.
Okay. Alright, that's great. Well, not so much, but it's alright. And then are you taking any medicines, prescription, over the counter?
No.
Okay, great. Alright. So let's see. Let's check out your nose. So I'm going to inspect this. So I'm going to look at the symmetry here. Right now it seems to be a little bit off to the right. And now I'm going to look see if there's any deformities or like any bumps or lumps or anything. And I mean, nothing completely abnormal. And you said you've never broken or anything before?
No.
Okay, so that seems fine. Alright, so I'm going to look up at your septum and just see. Yeah, it does seem that you have a slightly deviated septum. Shouldn't be anything too bad, but I do see that. I'm looking for any lesions or moles or anything. You just have freckles, normal, nothing bad. And now I'm going to ask you to plug one side, check for patency. So plug one side and breathe in as hard as you can. Okay, great. Now plug the other side. Now breathe in. Okay. So they seem pretty equal. Alright, so I mean, doesn't seem too bad. Alright, now I'm going to look at your nasal cavity and just check out the color and the integrity and the turbulence. So just look at the color. I'm just looking, exactly. I'm looking to see if it's just nice and pink, which it is. It doesn't seem to be extremely red or anything. I mean, you can close your mouth. Keep going. Alright, and you seem to have that like yellow mucus in there. It doesn't seem too bad. It's a little bit greenish, yellowish, chunky, yeah. Your turbinate seems slightly bit swollen. That's probably from sniffing, both superior and inferior. But everything looks pretty normal. Alright, so I'm going to palpate your external nose to feel for bumps. And then I'm going to check out your sinus area. So, you seem to have normal bumps, nothing too bad. And tell me if this hurts.
A little bit.
Alright, and what about here?
A little bit.
Okay. So those are your sinus areas. So that could mean that you have a sinus infection if that hurts a little bit. Okay, so now I'm going to inspect your mouth. So by doing that, I'm going to check your lips to see if they're cracked or anything. This seems to be good. Your teeth. So I would run my finger on the inside of your lip. So, okay. Alright. Your gums feel good. Now I'm going to check your tongue. So can you just stick out your tongue for me? Alright, that's perfect. Alright, so now I'm going to check out your buccal mucosa and your palate. Your buccal mucosa is the inside lining of your cheeks. Let me just look there. Alright, and now your palate. Alright, everything is nice and pink and it's shiny, which is good. If it wasn't, then we'd probably have a problem. Okay, so now please stare at your tongue and say ah. Alright, your uvula is shaking back and forth, which is good because that is talking about cranial nerve tense and that's intact, and that is great. Now I'm going to look at your throat and I'm going to grade your tongue. Hey. Okay, stick your tongue out and say ah. Alright, so your tonsils don't seem swollen at all. At most, it's a +1, which means they're only sticking out a little bit. But everything else seems really good. Great.
Oh, I also hit my head the other day. Well, not hit, but I got hit with a basketball right here in the head.
Oh, yeah. And when did this happen?
I guess a few days ago.
Okay.
Again.
Does it still hurt?
Yeah, sensitive.
Did you black out when you got hit?
I don't know. I got hit. I was in shock, so I don't really know.
Yeah. Did you fall, or were you still standing?
I was still standing.
Okay. And have you had any headaches since then?
Not really. Some, but nothing major.
Okay. And these headaches come and go, or is it just one-time thing?
They come and go.
Come and go. Is this unusual to have these headaches?
Yeah.
Okay. So let me just see your head then. First I'm going to inspect it and just see if I see anything. Alright, now I'm going to palpate it.
Okay, that's a little sensitive.
Yeah, a little bit?
Yeah.
Yeah, I feel the bump right there. That hurts. Huh?
Mm-hmm.
Alright, you're supposed to get, sorry, okay. Your head, alright, those. Alright. So now I'm going to check your temporal mandibular joint. So I'm going to ask you to open your jaw. Alright, you got some clicking there.
I'm TMJ.
TMJ, alright, yeah, do it again. One more time. Alright, does this ever give you headaches or anything?
Not this actually.
Oh, yeah, that's probably good advice. Alright, so I'm going to take out your face. So to check for symmetry, I'm going to ask you to smile. Alright, great, everything seems good. If your face is a little bit crooked or something, I would think that you could have, a cranial problem, or a nerve problem, or a stroke. But you're young, so. Okay, I didn't see any involuntary movement, like twitching or anything like that, throughout this whole interview, so I think that's okay. And does your face seem swollen, more swollen than normal?
No, I don't think so.
Yeah, it doesn't look swollen at all.
I don't look bloated.
No, you don't look bloated at all. And I don't see any lesions or mold or anything. I see maybe a little tiny mole there, but it isn't raised and the borders are even and the color is correct and everything else looks good with that. Okay, so now your neck. I'm just going to inspect your neck. And did you have any pain in your neck at all?
No, not really.
Okay. Alright, so I'm just going to palpate it. Does this hurt at all?
That's tickly, okay.
And check for symmetry. I'm just going to relax. I'm going to run my fingers down your trachea. Alright, that seems, relax. That seems normal. And now for range of motion, can you look up for me? And now down. And now to the right. And now to the left. And now all the way around. And any of that hurt at all?
No.
Okay, great. Alright, so now I'm going to check your lymph nodes. So I'm just going to start in the back here. And I'm going to work my way down your neck. And now back up. Just try to relax. And now I'm going to go across your jaw. And up to your chin. None of that seems swollen at all. So it's good that your lymph nodes aren't swollen. And now for your trachea. Okay, well, now I'm going to touch your trachea. And I just want to see if everything is normal there. Alright, and now I'm going to check your thyroid. So please sit with your back against here. And I'm going to place my fingers inside your thyroid here. And I'm going to ask you to tilt your head a little bit to the right. And I'm just going to move your trachea to the side and then please swallow. Okay, so your thyroid feels good. Doesn't seem enlarged or anything. So everything really seems fine. I don't think your head caused any big problems. If you continue getting headaches, please come back. Also with your nose, it seems like it's just a cold or maybe some allergies. Since you had a little bit of sinus pressure, it could turn into a sinus infection. So make sure you keep that checked and make sure you keep getting that looked at. But thank you very much.
Thank you.
Okay.